Hello, I'm Sara Thomas.
And I'm Mia Tran.
And I'm Madeleine Hauk.
We're told from the beginning that we're supposed to take care of our bodies, and if we do so, we can expect a long and healthy life. And that applies to everyone, as long as you weren't born with a disability or abnormality of any sort. But the problem with that is nearly half of Americans admit to being born with something or at least one medical problem from birth that they could not have prevented.
The conditions will vary in severity, some more serious than others. The topic of discussion today is focused on rather an extreme condition that has gone a long way from where it has started. Hint, another name for it is the royal disease.
Hemophilia. It's another name for a rare blood coagulation disorder. With this, blood fails to clot normally due to a deficiency in one or more of the clotting factors. Three most common types of hemophilia are A, B, and C. People who suffer from this usually suffer with A. This is a recessive trait found on the X chromosome.
Unfortunately, that does keep carriers from doing the things that they love most. A minor bruise to me or you can be life-threatening to them. Bleeding out internally is a constant threat. We believe that they deserve better, especially with today's technology. We believe that with the help of artificial transfusions, they can live normal lives.
In order to better understand our proposal, you need to understand what happens to a person with hemophilia. It's all about the clotting factor. Normally, blood vessels shrink when there seems to be a cut. This is useful because it stops large amounts of blood from leaking out.
Then the platelets kick in. They come together around the leaked patch over the wound. Lastly, the platelets, protein, calcium, and other tissue clotting factors bind together to make a clot stop bleeding. Normally, they would just do one of two treatments, either a replacement or preventative therapy. Replacement stops bleeding when it occurs, and preventative is used on a regular basis to prevent bleeding.
Both of which are painful, expensive, and stop you from being able to do the normal things that a person would need to be able to accomplish. So why not treat the root cause? We believe that by using the latest in 3D printing technology, we can make blood vessels based off the owner's own cell tissue. Then, ultimately, issue it into the person's bloodstream so that their bodies build up a vulnerability, causing them to produce the correct clotting factor.
Nothing of the sort has been tested, but if universities like the University of Pennsylvania, who are currently building regenerative organs using a 3D printer, were to take on this, we could potentially cure hemophilia by 2020.
We can't do this alone and need support by more than just people who suffer. That's a small group with not nearly enough support because of how rare it is.
We ask that you invest your time in researching hemophilia and realizing why this needs to be done, because even though it may not affect you, only you can help find the cure.